Hey everyone, welcome to Burnout and Scrubs, a podcast by students for students, specifically students in healthcare who are just trying to make it through. I'm Alexa Sanchez, a PA student and your moderator today, and I'm joined by my fellow classmates and friends Diana Cortada, Lisandra Rodriguez, and Karime Castillo. We're here to talk about something we've all felt but don't always feel safe talking about: burnout. And not just I had a long day burnout, but the real deep emotional fatigue that comes from years of academic pressure, clinical stress, and sometimes silence.
Yeah.
This episode breaks down the problem using the policy analysis framework from Chapter 14, and will share real ideas about what schools can and should be doing to protect students' mental health. Let's get into it.
All right. Thank you so much, Alexa, for that intro. So let's start with addressing the problem, which is burnout in healthcare students. It's real, it's widespread, and it's dangerous. We're juggling massive amounts of content constantly with long hours in clinic and constant performance pressure. So a study done by Health Affairs in 2021 actually reported that a growing trend in mental health disorders, especially anxiety and depression and chronic stress, among students in PA, med, and nursing programs.
Yeah, and it's not just the academic side. For a lot of us, there's a lot of family pressures, financial stress,
Yeah.
trying to be the first in our family to get through graduate school. I've had moments where I'm studying for an exam and also trying to figure out how I'm going to pay rent or support
Yeah.
someone at home.
That's so
And
true.
I know I'm not alone in that.
No, totally. And let's not forget about comparison culture.
Mhm.
Everyone looks like they've got it together, especially on social media or even just walking into class.
Yeah.
So you feel like you can't really say anything because maybe you're the one who's falling behind.
Mhm.
And that silence only makes the burnout even worse.
Wow.
Yeah.
So the study, according to Derby, over 50% of healthcare students actually show signs of emotional exhaustion before graduation.
Wow.
But they don't usually or typically feel safe disclosing this information.
Wow. And when you finally do reach out, it's kind of like there's a fear that asking for help might somehow affect how faculty views you or even how your peers view you. Like you're weak or not cut out for such a rigorous program or
Yeah.
Exactly. Yeah. So what we're looking at really is a systemic issue, not a personal one. Institutions aren't doing enough to normalize mental health care or build protective systems around student well-being.
Yeah.
It's time for schools to stop framing this as an individual coping
Yeah.
problem and start treating it like a policy issue.
Oh, yeah.
Absolutely.
Wow.
I agree.
So let's talk stakeholders. Who's affected and who has the power to make change?
Well, obviously, I think that us students are, at the center of it. But it also impacts the faculty who have to deal with the consequences like missed exams, disengaged students, or even
Yep.
sudden dropouts. And program directors as well, they can feel it too when their board passing rates go down or their accreditation is at risk.
Yeah.
And zooming out, think about the patients. We're training to be frontline providers. If we're already burning out now, how are we going to show up for others in high stress environments later on?
That's so
Yeah.
true.
The Robert Wood Johnson Foundation argues that burning out among students is a public health workforce issue that we take when we go into our jobs and not just a school problem.
No, absolutely. And you also have state policy organizations like the National Academy for State Health Policy, like in 2023 when they called out for investment in mental health infrastructure across higher education. They argued that students' well-being is tied directly to the future stability of the healthcare system.
Yeah.
And let's
Yeah.
not forget advocacy programs like the Integrative Healthcare Policy Consortium, which push for a whole person approach in health education. They treat mental and emotional wellness as core competencies, just like clinical reasoning or pharmacology.
Yeah, dude, why is burnout training not a class in the same way that pathology is?
Honestly, I'd pass that class with an A+. I definitely have a lot of experience with that.
No, absolutely. But all jokes aside, honestly, we need institutional
Yeah.
policy that reflects how hard that experience
Yeah.
truly is.
100%.
Yeah. So let's shift the conversation into solutions. What are the policy options you guys think schools could implement?
Well, I think option one is definitely ensuring that every healthcare education institution provides free, confidential, and easily accessible mental health services for students. And not just
that's a
some
good idea.
clunky third-party app, but actual therapists who understand the unique stress of clinical training.
Yeah.
So actually, a study done by the Kaiser Family Foundation in 2020 showed that there was an improvement in access to healthcare or mental health care services, significantly reduced stress levels, and boosted academic performance.
That's
Nice.
interesting.
Yeah. Another option would be making mental health and wellness education mandatory.
Absolutely, I
Not
agree.
just not an optional seminar, but like a recurring
Yeah.
part of the curriculum, because it's something we're constantly dealing with. We're talking about sessions on stress management, imposter syndrome,
Mm.
healthy
Yeah.
sleep, boundary settings. Like we don't really get that.
Mm-hmm.
There's a study in 2022 by the Health Study Policy Gateway that supports policies like this because they take a preventative approach rather than waiting for students to burn out.
Wow.
Wow.
That's
Yeah, no, definitely. And I think a third option could include, building protected wellness time. That could be
Mhm.
maybe like 1 day off per month, or shortened clinic hours during high stress week,
good. Mm.
or guaranteed breaks after major exams.
Yeah.
Like it's mentioned in Health Affairs in a study done in 2021 that showed that institutions that structured downtime into their calendars, they actually see lower attrition and higher satisfaction
Wow.
in the students.
And honestly, all three of these options are doable. They're grounded in evidence and supported by organizations with real policy expertise.
Mhm.
The question really is, what's stopping schools from implementing them?
Yeah.
That's an interesting take.
Yeah.
So, of the three, which option or combination do we recommend?
Well, I'd say we recommend a almost comprehensive institutional mental health policy that can combine all three strategies. That is inclusive of counseling access, wellness education, and protected time built right
Mm.
into the schedule. It's not about doing one thing, it's about changing the culture that's been
Yes.
created.
Wow. Yeah.
100% agree. And this isn't just our opinion. It's what organizations like the Robert Wood Johnson Foundation and Health Affairs advocate for. It's supported
Yeah.
by data, and more importantly, it's supported by students who are tired of suffering in silence.
Yes.
Yeah.
Yes. And I just want to add, that these policies don't just help students pass, they actually help us stay in the profession long term,
Yes.
And that matters, especially when the system is like already struggling to retain healthcare workers.
Yeah.
Like there's an increasing shortage of healthcare workers.
Very
Yeah.
true. That's a great point, Gadi. Well said. A healthy, supported student becomes a healthy, competent
Wow.
provider.
Yeah.
Period. That's the
Bars.
return on investment here. So, to wrap things up, burnout in healthcare students is not a personal failure, it's a policy failure. Schools need to stop treating this like a private issue and start building structural support that meets the emotional demands of professional training.
Absolutely.
Yeah.
It's time for institutions to move past surface level wellness campaigns and make real, policy driven commitments to student mental health.
Mhm.
And with that, we want to leave our classmates with 2 questions for the discussion board. First, what are the biggest barriers to implementing a comprehensive mental health policy in your program, and how might we overcome them?
Yeah.
And 2, have you seen any wellness strategies that actually work in academic or clinical environments? What made them effective? Let us know. We'll catch each. And with that, we want to leave our classmates with 2 questions for the discussion board. First, what are the biggest barriers to implementing a comprehensive mental health policy in your program, and how might we overcome them?
That's a good one.
And 2, have you seen any wellness strategies that actually work in academic or clinical environments, and what made them effective? So we'll each be responding to at least one of your posts, and we're excited to hear what you all think. Thanks for listening to Burnout in Scrubs. If this episode felt relatable, that's because it is. You're not alone, and together we can push for better.
Absolutely.
Thank you.
Yes.
Thank you,
Thank you.
Alexa.
Thank you, Alexa.
For having us
Thank you.
today.